A storm is brewing. It is not a storm of thunder and lightning, but a silent storm, a hidden plague. This plague has ravaged civilizations, toppled empires, and shattered families for centuries. It crosses borders and transcends time, leaving a trail of infertility, suffering, and death in its wake. This is the story of sexually transmitted diseases, a story whispered in hushed tones, shrouded in shame, and often ignored. It's a story that needs to be told. We must drag it from the shadows and expose it to the light of truth. For too long, we have been complacent, lulled into a false sense of security by modern medicine. But the enemy is evolving, growing stronger and more resistant. The threat is real, and it is closer than you think. This is not just a story of the past. It is a stark warning for the present, and a call to action for the future. Our very survival, as individuals, families, and a species, may depend on it. Journey back in time with me. Imagine the once mighty Inca Empire, its cities gleaming gold, its people vibrant and strong. Yet, even in their prime, a silent killer stalked their streets. Syphilis, a ruthless and unforgiving disease, ripped through the empire, leaving devastation in its wake. And the Spanish conquistadors arriving on their shores did not just bring gunpowder and steel. They unwittingly unleashed a biological weapon that would decimate a civilization. But this was not a victory of strength. It was a victory of silence. The Spanish, desperate to hide their shame and solidify their conquest, systematically erased any trace of the disease's impact. Medical records were destroyed, stories were suppressed, and the truth was buried under a mountain of lies.
But the past has a way of whispering its secrets to those who listen. Today, the bones of the Inca tell a different story. A story of a civilization brought to its knees by a hidden enemy.
The past, they say, is a foreign country. But is it really? While we may have traded Incan temples for skyscrapers and conquistadors for politicians, the enemy remains the same, silent, insidious, and deadly.
Today, STDs like chlamydia, gonorrhea, and HIV are spreading at alarming rates. They are a ticking time bomb, a global health crisis hiding in plain sight. Millions are infected, often unaware, carrying a silent threat within their own bodies. The consequences are devastating: infertility, chronic pain, increased risk of cancer, and even death. Families are torn apart, dreams are shattered, and the future of entire generations hangs in the balance. We can no longer afford to ignore the warning signs. The echoes of the past are growing louder, reminding us that history has a chilling habit of repeating itself. The time to act is now, before the silent storm becomes a deafening roar.
When Francisco Pizarro and his conquistadors arrived on the shores of modern-day Peru in 1532, they encountered an empire already weakened, its population ravaged by disease. The culprit, syphilis, a sexually transmitted infection that had likely arrived with earlier European explorers. Unknowingly, the Spanish had brought with them a weapon far more potent than any sword or cannon. Syphilis spread like wildfire through the Inca Empire, its effects as devastating as they were insidious. The disease in its later stages attacked the bones, leaving telltale marks that archaeologists still uncover today. The Inca, with their sophisticated understanding of medicine and herbal remedies, were powerless against this unseen enemy. Their traditional healers, accustomed to battling familiar ailments, had no answer for the scourge that was decimating their population. The empire, weakened from within, the Inca, with their meticulously crafted stone cities nestled high in the Andes, seemed invincible. Their empire stretched across vast distances, a testament to their ingenuity, organization, and military prowess. Yet, Beneath the veneer of power, a rot was taking hold, a silent enemy that would bring this mighty civilization to its knees. Syphilis, often referred to as the Great Imitator, manifested in a myriad of ways. It began with sores, painless but highly contagious, that spread the infection through intimate contact.
As the disease progressed, it attacked internal organs, causing a litany of debilitating symptoms. Pregnant women who contracted syphilis often suffered miscarriages or gave birth to stillborn children. Those infants who survived were often afflicted with congenital syphilis, leading to deformities, blindness, and early death. The impact on the Inca birth rate was catastrophic.
The Spanish, witnessing the devastating effects of the disease they had unleashed, were quick to exploit the situation. They spread rumors of divine punishment, portraying the Inca as cursed and their empire deserving of conquest. This propaganda served not only to justify their own actions, but also to sow fear and discord amongst the already weakened Inca.
The Spanish, however, were not immune to the disease themselves. Syphilis spread through their ranks as well. A grim reminder that disease knows no boundaries, no loyalty, and no mercy. Yet the conquistadors, driven by greed and ambition, pressed on, their lust for gold and glory outweighing the fear of the invisible enemy in their midst.
Centuries later, the bones of the Inca whisper their tragic tale. Archaeological excavations across South America have unearthed mass graves filled with the skeletal remains of those who perished during this period of unprecedented devastation.
The bones themselves bear witness to the horrors of syphilis. Scientists, using modern imaging techniques, have identified the telltale lesions and deformities that mark the disease's relentless assault on the human body. These skeletal remnants serve as a stark reminder of the disease's ability to decimate entire populations.
In the coastal deserts of Peru, archaeologists have uncovered mummies, their preserved remains offering a chilling glimpse into the past. Some of these mummies, dating back to the time of the Inca Empire, show clear signs of syphilis, their bones twisted and deformed by the disease.
These silent witnesses, buried for centuries, offer a powerful counter-narrative to the sanitized version of history often presented. They are a testament to the human cost of conquest and the enduring legacy of a disease that continues to plague humanity. The story of syphilis in the Americas does not end with the Inca. Thousands of miles north, in the heart of what is now Mexico City, lies another grim chapter in this tale of disease and devastation. Beneath the bustling streets, beneath the modern buildings, and the flow of daily life, lies a necropolis of secrets. When the Spanish established Mexico City on the ruins of the Aztec capital, Tenochtitlan, they unknowingly built atop a graveyard of epic proportions. The ground beneath their feet was saturated with the remains of thousands who had perished just decades earlier, victims of a mysterious and deadly epidemic. This epidemic, known as Coca-Lisli, swept through central Mexico in the 16th century, killing an estimated 7 to 17 million people. Its symptoms were horrifying high fever, severe abdominal pain, jaundice, and bleeding from the eyes, nose, and mouth. Death often came within days. For centuries, the cause of Coca-Lisli remained a mystery. Some speculated it was a hemorrhagic fever, while others blamed it on drought or famine. However, recent analysis of skeletal remains from mass graves beneath Mexico City has revealed a more sinister culprit, a deadly form of Salmonella enterica, a bacterium known to cause typhoid fever.
The story of the ancient plagues, from the fall of the Inca to the devastation of Cocolitztli, is not just a historical curiosity. It is a cautionary tale about the power of disease, the fragility of civilizations, and the dangerous cycle of silence and denial.
The Spanish, in their attempts to erase the true impact of syphilis and other diseases, engaged in a deliberate campaign of historical revisionism. They sought to protect their image, to maintain control, and to justify their actions. Today, we face a similar challenge.
STDs are on the rise globally, fueled by a lack of education, limited access to healthcare, and persistent stigma. Yet, too often, we shy away from discussing these issues openly and honestly. We must break this cycle of silence.
We must learn from the mistakes of the past and confront the challenges of the present with honesty, compassion, and a commitment to action. The future of our own civilization may depend on it. The echoes of ancient plagues resonate deeply in our modern world. While we may have conquered smallpox and tamed polio, a new plague has emerged, a silent and insidious threat to our future, infertility, and at its heart lies a familiar foe, sexually transmitted diseases.
Across the globe, millions of couples struggle to conceive, their dreams of parenthood dashed by the cruel reality of infertility. While the causes of infertility are complex and varied, one factor looms large: the often hidden damage inflicted by STDs.
Chlamydia, gonorrhea, and other STDs, if left untreated, can wreak havoc on the reproductive system. They leave behind a trail of scar tissue, blocked fallopian tubes, and damaged sperm, robbing individuals and couples of their ability to conceive.
This modern plague of infertility is not confined to one corner of the world. Its reach is global, affecting people of all ages, backgrounds, and socioeconomic statuses. It is a silent crisis, often shrouded in shame and secrecy, but its impact is profound, affecting not just individuals and families, but also the very fabric of our societies.
The true insidiousness of STDs lies in their ability to inflict damage even when symptoms are mild or absent. Many people, particularly women, contract chlamydia or gonorrhea without ever experiencing noticeable signs of infection. They become silent carriers, unaware of the threat they carry within their own bodies.
Unbeknownst to them, the infection silently spreads, inflaming delicate tissues, leaving behind microscopic scars that can have life-altering consequences. Fallopian tubes, those delicate pathways essential for egg transport, become scarred and blocked, preventing fertilization and increasing the risk of ectopic pregnancy.
In men, untreated STDs can lead to epididymitis, a painful inflammation of the testicles, and prostatitis, an infection of the prostate gland. Both conditions can impair sperm production and motility, reducing a man's chances of fathering a child.
The tragedy of this silent assault is that it is often only when couples face difficulties conceiving that the true extent of the damage becomes apparent. By then, the scars of infection have already been etched, leaving behind a legacy of heartbreak and dashed dreams.
The inability to conceive casts a long shadow, affecting not just physical health but also emotional well-being and social standing. The longing for a child can become all-consuming, casting a pall over their lives.
Couples struggling with infertility often describe feelings of isolation, shame, and inadequacy.
The social pressure to reproduce can be immense, particularly in cultures where family lineage is paramount.
Couples facing infertility may encounter insensitive questions, unsolicited advice, and even outright judgment from family, friends, and society at large.
The financial burden of Infertility treatment can be crippling. In many countries, assisted reproductive technologies like IVF are expensive and often not covered by insurance.
This creates a two-tiered system, where only the affluent can afford to access treatments that may offer a chance at parenthood.
The emotional, social, and financial toll of infertility underscores the urgent need for greater awareness, prevention, and treatment of STDs.
We must break the silence surrounding these infections and address the underlying factors that contribute to their spread.
The devastating impact of STDs on fertility is starkly illustrated in Nigeria, a nation grappling with a multifaceted public health crisis.
According to the World Health Organization, an alarming 30% of infertility cases in Nigeria are directly linked to untreated STDs.
This staggering figure highlights the urgent need for accessible and comprehensive sexual and reproductive health care services in the country.
Factors such as poverty, limited access to education, and cultural taboos contribute to the spread of STDs and hinder efforts to combat their devastating consequences.
The Nigerian government, in collaboration with international organizations, has implemented programs to raise awareness about STDs and promote safe sex practices.
However, much more needs to be done to address the root causes of this crisis, including improving access to healthcare, challenging harmful cultural norms, and empowering women to make informed decisions about their sexual health.
Nigeria's struggle with STD-related infertility serves as a stark reminder that this is not just a personal tragedy. It is a public health emergency that demands a coordinated and comprehensive response. As if the current burden of STDs were not alarming enough, a new threat looms on the horizon: the rise of antibiotic-resistant gonorrhea.
This sexually transmitted infection, once easily treatable with antibiotics, is rapidly evolving, developing resistance to the very drugs designed to cure it.
The Centers for Disease Control and Prevention has issued dire warnings about the emergence of supergonorrhea, a strain resistant to all but one class of antibiotics.
If this last line of defense crumbles, we face the terrifying prospect of an untreatable STD spreading unchecked through the population.
The implications of such a scenario are chilling. Untreated gonorrhea can lead to pelvic inflammatory disease, ectopic pregnancy, infertility, and even life-threatening complications.
It can also increase the risk of contracting other STDs, including HIV.
The antibiotic apocalypse, once a distant threat, is now a clear and present danger.
The rise of superbugs, fueled by the overuse and misuse of antibiotics, threatens to undermine decades of medical progress and plunge us into a post-antibiotic era. The convergence of antibiotic resistance and the silent spread of STDs creates a perfect storm, a public health crisis of potentially catastrophic proportions. We are facing an enemy that is both evolving and elusive, capable of spreading undetected while simultaneously developing resistance to our most potent weapons.
The consequences of inaction are too dire to contemplate. We risk returning to a time when STDs were a death sentence, when infertility was rampant, and when simple infections could prove fatal. The hard-won victories of modern medicine are at stake.
This is a call to action, a plea for greater awareness, increased funding for research, and a renewed commitment to public health. We must act now before the silent storm of STDs becomes a deafening roar, before the echoes of ancient plagues become the harbingers of our own demise.
The Spanish conquistadors, driven by an insatiable thirst for gold and glory, unleashed a silent weapon upon the Americas' disease. But their conquest was not merely a matter of swords and muskets. It was a calculated campaign of biological warfare.
The Inca, despite their advanced understanding of medicine, were ill-equipped to combat the onslaught of syphilis. The Spanish, witnessing the devastating effects of the plague they had unleashed, were quick to exploit the situation. They spread rumors of divine retribution, portraying the Inca as cursed.
This manipulation of faith served to justify their brutality and sow fear among the indigenous population. The Spanish systematically eradicated indigenous knowledge. They burned countless quipus, the intricate knotted cords used by the Inca to record information.
They torched libraries filled with codices, destroying centuries of accumulated wisdom. This cultural genocide was a deliberate strategy to maintain control and ensure the conquered population remained ignorant and powerless.
Centuries have passed since the fall of the Inca Empire, but the echoes of colonial oppression reverberate to this day. While we may no longer burn books, the suppression of knowledge and neglect of public health continue in more subtle forms.
Governments and institutions often fail to prioritize the fight against STDs. Funding for sexual health education is slashed. Clinics face closure, and research remains inadequate.
This neglect reflects societal biases, a reluctance to confront truths about sexuality, and persistent stigma.
The consequences are borne disproportionately by marginalized communities, people of color, and those living in poverty. These individuals often lack access to quality health care and comprehensive sexual education.
The parallels to the colonial era are stark. Modern systems of power perpetuate health disparities, sacrificing the well-being of the marginalized.
Profit over people. The pharmaceutical shame. In a world driven by profit, healthcare has become a commodity. The pharmaceutical industry has a moral imperative to prioritize life-saving medications.
However, the pursuit of profit often trumps public health. Pharmaceutical giants reap billions from lifestyle drugs, while the development of new antibiotics lags.
The financial incentives to invest in diseases affecting low-income countries are not compelling enough. This prioritization of profit over people has dire consequences for global health. As antibiotic resistance rises, we face the prospect of returning to a pre-antibiotic era.
The pharmaceutical industry must shift its priorities and invest in pressing global health challenges. Failure to do so is a moral stain on humanity.
The blame game. Perpetuating stigma and silence. The stigma surrounding STDs is a potent weapon, wielded to shame and silence. It prevents open conversations about sexual health and discourages individuals from seeking treatment.
From doctors' offices to media headlines, the language used to discuss STDs is often judgmental. Individuals with STDs are portrayed as irresponsible or promiscuous. This blame game exacerbates the problem, driving it underground.
Fear of judgment prevents people from disclosing their status, leading to the spread of infection. We must challenge the stigma and foster a culture of empathy and understanding. We must shift the narrative to one of public health and collective action. By doing so, we can address the issue more effectively. A conspiracy of silence, the media's role. Ideally, the media would illuminate injustice and amplify marginalized voices. However, the media often perpetuates harmful stereotypes and sensationalizes outbreaks.
The media shapes public perception and influences policy decisions. Sensationalized coverage reinforces stigmas and discourages individuals from seeking treatment.
The media has a moral obligation to report on STDs responsibly. By providing factual information and challenging stereotypes, the media can combat the epidemic. Accurate reporting fosters a more informed and empathetic society. The weight of history of empires toppled by STDs hangs heavy, but amidst the ruins a glimmer of hope emerges. We have the power to break the cycle and reclaim our future.
This is not a battle for one nation alone. It demands a global awakening and recognition that STDs are a shared threat. Our interconnected world allows diseases to spread quickly, necessitating a coordinated response.
We must move beyond indifference and outdated ideologies. The time for complacency is past. The stakes are too high. We must meet this challenge with urgency and innovation.
The path forward requires education, prevention, treatment, and advocacy. It demands a shift in attitudes and dismantling of stigma. Together, we can forge a future where STDs are addressed with compassion and commitment.
Amidst the despair, beacons of hope emerge. In Mexico, mobile clinics bring testing and treatment to those in need.
These units reach remote communities and underserved populations. They connect vulnerable individuals with essential healthcare services.
Beyond medical services, these clinics foster community engagement. They challenge harmful cultural norms and empower individuals.
Mexico's Mobile Clinic Initiative highlights the power of breaking down barriers. It is a model worthy of emulation, showcasing the potential of innovative public health interventions. In the face of a global health crisis, silence is not an option. We must break the taboo and raise our voices.
Speaking out ignites the flames of change.
Every voice raised chips away at the wall of indifference.
It is time to shift the focus to compassion and understanding.
We must demand better from our healthcare systems.
Hold elected officials accountable and prioritize public health.
The call to action extends to our homes and communities.
It starts with honest conversations with loved ones.
Challenge harmful stereotypes and create a culture of strength. Together we can make a difference.
Check, check, check one, check two, check, check.
Reclaiming our future. A call to arms. The time for half measures is over. The time for complacency is past. We stand at a crossroads in the fight against STDs. The echoes of past pandemics remind us that inaction is not an option.
We have the knowledge and resources to turn the tide. What we need now is collective will and commitment. This is not a battle for the faint of heart.
Let this be our rallying cry. We will not be defined by diseases. We will not be silenced by stigma. We will not stand idly by as history repeats itself. This is our fight. This is our time. Let us rise together and reclaim our future. From Machu Picchu to modern metropolises, STDs have haunted humanity for centuries. The fall of empires and shattered dreams are stark reminders of these insidious enemies. We are bound to the past by our shared humanity. The mistakes of the past echo through the ages. The cycle of infection and suffering continues, fueled by ignorance and indifference. We allow history to repeat itself at our peril. And the time has come to break free from the past and choose a different path. We have the power to forge a future where STDs are a shared challenge faced with compassion and innovation. The legacy we leave behind will not be measured in monuments of stone or testaments of gold, but in the health and well-being of generations to come. We are the inheritors of a world shaped by both the triumphs and the tragedies of the past, and we bear the responsibility to leave it a better place than we found it.
The fight against STDs is not merely a medical battle. It is a struggle for social justice, a testament to our shared humanity. It is a fight to empower individuals with knowledge and agency, to break down barriers of stigma and discrimination, to ensure that every person, regardless of background or circumstance, has the opportunity to live a healthy and fulfilling life.
Imagine a future where sexual health is no longer shrouded in shame, where open and honest conversations about STDs are commonplace, where testing and treatment are readily accessible to all, where scientific advancements continue to outpace the evolution of these ancient enemies. This is the legacy we can choose to create. A legacy built not on fear or silence, but on courage, compassion, and an unwavering belief in our collective capacity to overcome even the most daunting challenges. The call to action is not a whisper on the wind, but a clarion call that reverberates in the heart of every human being. It is a call to embrace our shared responsibility, to stand in solidarity with those most affected by STDs, to demand better from our leaders and ourselves.
We must challenge the complacency, the indifference, the outdated ideologies that perpetuate the cycle of infection and suffering. We must demand increased funding for research, prevention, and treatment, holding our elected officials accountable for their inaction and demanding a public health response that matches the urgency of this crisis.
But the fight against STDs is not just a battle fought in laboratories or legislative chambers. It is a struggle waged in our homes, our schools, our communities. It begins with honest conversations, with dismantling stigma, with creating a culture where seeking help is not a source of shame, but a sign of strength.
We must empower our children with knowledge, equipping them with the tools and information they need to make responsible choices about their sexual health. We must support those living with STDs, offering compassion, understanding, and a helping hand, not judgment or isolation.
This is not a battle for the faint of heart, but for those who believe in the power of human resilience, in the promise of scientific progress, in the enduring strength of the human spirit. The time for excuses is over. The time for action is now. Let us rise to the challenge together and reclaim our future.